Dr. V.
And I'm Dr. A, two doctors on a mission to answer your burning questions about burning sensations and all things science.
This is What the Woo. So we have reader mail.
No way. What do we have?
We have a website that somebody sent to us, and it's a doozy.
I mean,
okay, here it is. I'm gonna pull it up. Here, Jamu stick.
Like a virgin again, return to your former tightness in seconds. Oh wow!
It's a pumice stone
for your vag.
For your vag, and that.
I mean, who doesn't need that?
Everybody.
Apparently. God, I kind of wish I could know their sales stats.
100% herbal.
Oh, well, then it must be perfect and great for you.
So the thing that cracks me up is it's got all these like very obvious like pictures of orchids and stuff. Return to your former tightness in seconds.
Always the same feelings like the first time.
Okay.
That's not a good thing.
Think back to your... I would be happy to not experience that again.
There's no way I want to go back to my first time, and I'm certainly not going to spend money to do it.
Discomfort.
Bleeding. Yeah, it's not good. With the natural product intended for vaginal cleansing, balancing urovaginal microflora, elimination of vaginal discharge and odor, tightening of the vagina, increase of libido, and intensification of sexual feelings. I mean, what do you say to that?
So this is what it claims is its mechanism of action. By removing the dead skin cells of the surface layers of the vaginal epithelial skin, Jamu stick helps to regenerate and balance the microflora. So basically, it is saying it's an exfoliator. And that's a good thing.
You don't want to exfoliate your vagina.
No.
It's a mucous membrane.
Do you exfoliate your nose?
That's my thought is like, we make mucus to like clear out what's, like old skin cells, let's say, or, debris that gets in there. You don't need to stick a pumice stone in your vag to get rid of it.
I think people are really unclear about the different types of skin that we have, right? You've got your skin on your arms, which gets all chickeny and dried out in the winter, and then you exfoliate that, but it's tough.
Right.
It's meant to be exposed to the environment.
It's not like your eyelids, like the inner eyelids or inside your nose or inside your vagina, which is a mucous membrane. It is sensitive skin. It makes its own mucus or, in the case of your eyes, tears that kind of flush things out. You don't need to stick something in and scrape it.
I think my baseline for comparison, anytime I read somebody claiming that you need to do something to your vagina, I'm going to say, would you do the same thing to your eyelids?
I think it's a good plan.
Yeah, like would you exfoliate the inside of your eyelids?
Right. Would you stick herbs in there to change the pH?
Flush it with acid? No, I'm good.
No, it's it's really wrong. And again, it's this whole like make your vagina smell fresh, be tight. All of these things to give these women like a complex.
It's back to this misogyny. Okay, so this is basically the purpose of this stick and why it's been around from generation to generation for thousands of years. Okay, we're talking like in pre-biblical era.
They had the Jamu stick?
Yes, and we have to ask our friends from our last cast if they learned about that in their fundy. Which book has the Jamu stick?
Which book of the Bible discussed the Jamu stick?
Matthew 3 point something.
Yeah.
So, take care of husband is a very important life challenge and involves a very carefully concerned... So, look, if you don't even care enough to get your grammar right, I'm not going to care about exfoliating my vagina for you. I want to get... This is the last paragraph. Each paragraph is like a treasure.
No.
Yeah, okay, so the first one was talking about exfoliating your vagina, and then it moved down to why, because you want a fragrant vagina.
For your husband.
And then the third one tells you how to use it. So it's 12 centimeters long. in 2.5 centimeters. I thought it was inches at first. Okay, 12 centimeters is a little bit better.
That is.
However, it's inserted into the vagina. It should remain for 30 seconds. That gives enough time for the herbs stimulating hormone balance and strengthen your flabby vagina.
No, it does not say that. Flabby.
Strengthens your flabby vaginal muscles.
No.
Yes. Tightening is noticeable immediately after the first use. So I'm wondering if the tightening it's spasming.
Yeah.
Like, ow.
Calluses.
And somebody had said that they were feeling, oh no. Oh no.
What?
After a very short time processing Jamu stick inside vagina, all the problems are literally glued to the surface of the stick.
I don't even want to see what she pulled out of her vagina. Oh, she needs to see a clinic. She does not need to stick a Jamu stick in
You don't
there.
need anything glued to the inside of your vagina.
I know.
Jamu stick is suitable for all ages?
No. Oh, God. Don't give this to your kids. It is not a toy. They've also got they've got different colors. Have you found that on the page?
No, I'm still stuck at medical study.
Oh, I didn't see medical study.
It's right under the picture of the banana. How to use Jamu stick. You apparently only use it when you're laying down on a bed of tropical flowers.
Oh, okay. Well,
before using the Jamu stick, wash your hands and vagina. I thought that's what the Jamu stick was supposed to do. How do you wash? Oh, about me.
Oh, it talks about who invented this?
My full name is very long, so call me Ika.
I'll call you Eek.
I come from a small village. We live naturally. My mother said the real beauty of a woman is not just what people see in your face, but what's in your vagina, I guess.
How you scrape out your vagina.
But how your attitude, behavior in life, kindness, and intelligence. Okay, so your mom didn't say anything about...
She did not say make a yoni stick.
No, she said be intelligent. This seems to go... against what your mother was telling you.
And be a good person. Like, those are great things for a mom to tell a kid.
Oh, shut up. Look at this. I have an amazing husband who helps me be a better person. He gave me an idea. Gee,
of course he did.
I wonder where this came from.
Oh, of course. You're not using this stick to clean out your vagina. This is a sexual product, which now it makes sense why she's saying it increases libido. Because I was trying to figure out, like, how does sticking a pumice stone in your vag increase libido?
If you're a control freak, there's probably something to be said for, like, getting your partner to scrape themselves out to make you happy, I suppose.
Right.
If you're a horrible human.
Or if you're using this as a sexual toy instead of as a medical product.
I feel like there's better options out there than a pumice stone.
Yeah, lots of them, and they're made with non-porous materials.
Oh man, did you find yourself getting a lot of questions about that?
I did.
Yeah,
I did. So I put together a lot of questions. You want me to ask?
You know, I would be curious because I mean, honestly, I've been with the same person for 20 years. So there's probably been some updates in our knowledge. I haven't had any sort of formal education since high school. Like, we don't sit around and talk about this stuff.
Right. You didn't know the Jamu stick existed.
No, I didn't. But even like some of the more basic things about, you know, what's out there, how people are treated, like I wouldn't be able to answer anyone's questions. So I'm super curious. If you ask me questions, I'm probably not going to know any of the answers. But we'll play along.
Okay.
You can ask me and I'll get them all wrong.
Yeah. So here's a thought. So let's say you have an STD, a sexually transmitted disease,
okay,
and you get treated. I mean, not you personally, a friend.
Yes. We'll call her Ika.
Ika. Yes, that's a great name. So let's say Ika has chlamydia, and she gets it treated and her partner gets treated. And now she's wondering, do I have to throw out my Jamu stick? Do I have to throw out my toys? She's been treated.
Well, I think she should throw out the Jamu stick regardless.
Good plan.
it would maybe depend on, I mean, and that's a good point. What exactly you're talking about, because some things are probably easier to disinfect than others. Like I wouldn't just run something underwater, but I would assume if you clean it off with soap and water, then you're good to go.
Yeah. So I think that's the big thing is, are you dealing with something porous or non-porous? And so, our non-porous toys might be things made with silicone, which is, the vast majority of toys. There are some that are made with plastics that do have some porosity. There's certainly things made with glass. Yeah, I know. I mean, personally, I have some concerns with sticking glass in a vagina. Yeah. But, people buy them. So, but glass is non-porous. Yay. Yeah. But Jamu sticks, super porous. So if it's non-porous, the research shows that you can wash it with soap and water, let that thing dry, and let it dry for like a good 24 hours so that we're decreasing the chance that there are little pieces of bacteria or virus that are left.
So what if you have one of those like cool Amish ones that you can get? It's made out of wood.
Yeah, don't no. If you have a wooden toy or a Jamu stick, I would say that it's probably safe to throw that away and get something new. And since you're buying something new, you should probably buy it non-porous.
Yeah.
More questions for you, though.
All right. I think I did pretty good on that one.
I think you were.
Let's up the ante.
Yeah. How about this? 2 condoms. Are 2 condoms better than 1 in decreasing your STD risk?
Who would do that? Do people do that?
I mean, if 1 is good, 2 is better, right?
Well, I mean, if you don't have faith in 1, why would you have faith in... Like, I would think... I could see on the surface how you might think that, but I would assume that you're just increasing the risk of one... like messing up the other. So I'm going to say false.
Ding, ding, ding. You are correct. Yay. So we can increase your risk of condom breakage putting 2 together. Obviously, you've got lots more friction with 2 latex parts rubbing against each other, even with or without any lubrication. We don't want that increased friction. Increases breakage and increases the chance of the condom coming off. Bad news bears. And also when we lose a condom and when we increase friction to a mucous membrane, it opens up, tiny microcuts, which increases your risk of sexually transmitted infection transmission as well.
I would assume the Jamu stick would also.
Yeah.
Well, you're not like you've exfoliated the entire top layer of epithelial cells.
Absolutely. You are creating lots of micro tears.
I'm still cringing.
Or even big tears.
So if 2's better than 1, wouldn't you want to put 8 on?
Oh, God. I'm not even going to picture this.
Cut off your blood circulation.
Yeah, absolutely. Can you tell if your partner has a sexually transmitted infection by looking at him? Not with his clothes on, I mean, with the clothes off.
I guess does it depend on the infection? I mean, some things you would think would be visible. Like if you're looking at something that's like a snotty nose, then I would be suspicious.
So when you say snotty nose, are we talking about penile discharge?
Yes.
Okay. Just making sure that you were using nose as your phallus analogy.
Yes. I'm using the Victorian analogy.
Aww. Dr. V and her Catholic upbringing.
So because I know that some diseases you can't tell. HIV, you wouldn't be able to tell by looking at someone, but some of them you would. I wouldn't hang my hat on it, but
right. Like if your partner has an open sore on their genitals, you probably want to stay away from that. Now there's a chance
want to follow up on that.
Yeah, they need to see a doc. Now certainly there's a chance that open sore is just I don't know, yeast infection, or even they got a bad scratch or something that got infected. And this is not a sexually transmitted infection. But I think that,
Is that common for people to get bad scratches on their genitals?
Unfortunately, yes. I have treated a lot of genital infections in my day, and you would be impressed with how many are just normal skin infections that go bad because, it's a warm, moist environment, and bacteria love warm, moist environments. So, but I think the big takeaway is that even if your partner looks clean, that we need to make sure that partners get tested, because you can't tell. Someone can look, perfect down below and still have an STD.
And somebody could be like totally greasy, but be clean.
Be totally clean. I mean, not have STDs. They might still be dirty and need a shower.
Which would be another, I think it's fair to put the kibosh something if they're covered in dirt.
True that. Yes. Unless that's your thing. No, I'm not going to knock it. So, I think along that line, we should probably talk about, like, if you do have a skin lesion on your own and it goes away on its own. Sorry. If you have a skin lesion, it goes away on its own. You're good to go. Do you have to worry anymore?
I actually don't know the answer to that, because I think I had heard that there were, like, I remember at one point hearing that herpes was only contagious when you actually have a lesion, but I don't even know if that's true.
Yeah, so it's not true. So herpes can actually be transmitted even if you have no lesions. It can be transmitted even if you've never had a lesion. So we call that like asymptomatic shedding.
We call it a bummer.
I know, big fat bummer, because, the vast majority of the population has herpes.
Really?
Yeah, actually. So there are two types of herpes. HSV1 and HSV2. HSV1 is generally thought to be in your mouth. Mm-hmm. HSV2 is generally thought to be in your genitals. Now, certainly we can get genital oral spread. So let's say you have a cold sore. That's herpes, and you give oral sex to your partner. So now you've taken HSV1 and moved it to the genitals. Now, certainly HSV1's happy place is in your mouth, and HSV2 happy place is in the genitals, but they can switch up because, they're opportunistic.
And when you say happy place, do you mean that the infection would be less severe in its non-happy place, or does it not necessarily even correlate?
No, it doesn't really correlate. Yeah. So, back to that herpes though, so you can get spread even when you don't have or have lesions. Also, let's say with herpes, you can have a lesion and then it goes away on its own. Doesn't mean it's cured at all, right?
It stays dormant, right?
It does.
Okay, now here's a question.
There's other things though, too.
Herpes lesions, where are they? Because, I'm familiar with, I would think if they were in the mucous membranes, then that would be internal, but are there external lesions?
Yes. So we can have herpes lesions that end up on your mouth, your gums, your, internal mouth. So your upper palate, things like that. We can also, have a cold sore. The vast majority of cold sores are caused by herpes, and those are on your outer lip. So that's not really a mucous membrane. Generally, it does start kind of at the edge of where your mucous membrane moves to regular skin. And then, of course, herpes lesions in the genitals can be all over. So you can have them internally in your vagina, or generally in the introitus, so where your vaginal opening is. We can have them on the skin, like your labia, and you can even get spread, in your groin. We also have things called herpetic whitlows, which are actually, I know, I see your weird face. It's like a herpes lesion on your finger. Yeah, so we can have herpes is really, it's a pretty strong virus, and it likes to live wherever it can.
It's like the cheese touch. You'd only get that.
No, I don't know what that is. Is that an animal thing?
No, it's actually a middle schooler thing from one of the Diary of a Wimpy Kid books. They talk about the cheese touch.
No.
Like where you can, like I would, God, now you have to worry about fingers too.
Yeah.
It just sounds like,
It's
like
not
the
the most
Cyclops
common.
where there's like a little scary eyeball where it's not supposed to be, like in Pan's Labyrinth.
Yeah.
I don't know. I just that sounds painful, and I know I keep coming back to the Jamu stick, but I just it pains me to think about somebody having this lesion and then trying to scrape it off.
Yeah, because they hurt really bad.
And I'm sure that doesn't help.
Right. Yeah, speaking of other genital lesions, I think the big one we need to talk about before we move to our next quiz question is syphilis. Because it is rising.
Is it?
Oh, yeah. It's so much of a deal now that we have to, there were educational things put out by the county that were saying, hey, make sure to test pregnant women for syphilis. Obviously, syphilis for a growing fetus is a terrible thing. But because syphilis is really growing in numbers, it's become a big issue. And the problem is that you get an external lesion, you get an ulcer, and it's painless. So, you think no biggie, right? Like, people don't go to the doctor if something doesn't hurt. And then the thing is syphilis ulcers go away. They go away on their own, and you think, okay, cool, like it didn't hurt and my little bumpy bump went away, and so I'm good to go. The problem is that syphilis just goes and hangs out, and then it like travels to your nervous system, and you can get all sorts of terrible syphilis that causes problems in your brain.
Okay, so that's the one I remember hearing about, like in the 1800s, right? That like these mostly guys would like get it and then go crazy and stuff.
There's
kind of syphilis.
Yeah, there's that. I don't know if it's ever been proven, but Edgar Allan Poe and the Telltale Heart.
Yes.
Yeah. So they were thinking that the Telltale Heart was about basically neurosyphilis and this guy going mad because he just had syphilis that he didn't treat.
Well, that would explain a lot.
Yeah.
About Edgar Allan Poe's works.
Right.
I mean, I love them. They're super gothy, but also super gruesome.
Yeah.
Well, think about where our canon of American literature would be without syphilis.
Oh, my life wouldn't be complete. My middle school and high school reading list would be a lot shorter.
Yeah.
Okay, so I have another question for you.
Okay.
So, do you know if STDs can be transmitted via oral sex?
Some of them.
Okay.
But
what STDs could be transmitted via oral sex?
Well, I only know about herpes since we just discussed
Since I gave that away.
Yes, but honestly, I wouldn't have. That's the only one that would occur to me.
Yeah, so lots of other stuff. So HPV is a big one. So HPV is human papillomavirus. That is the virus that increases your risk for cervical cancer as a woman.
That we have a vaccine for as well.
We do, and it's awesome. And I mean, heck, it's the vaccine that prevents cancer. Why isn't everyone getting that?
Why isn't everyone getting it? That's a whole nother episode, isn't it?
That's a whole nother episode. Yeah. So, but anyways, yeah. So HPV, if you are performing oral sex on someone who has HPV, which can be the virus that is increasing your risk of cervical cancer, it's also the same virus that causes genital warts. So, if they have HPV, you can get it inoculated into your mouth, and it increases your risk of throat cancer and oral cancers.
I did not know about that until Michael Douglas.
I know nothing about this. Michael Douglas.
He got, I think it was oropharyngeal cancer. And he said, oh, no, it's not because of smoking, because that's like not cool anymore. But he said it was because he performed too much oral sex when he was younger.
Wow, that's one way to turn it around.
Right? I was impressed at the spin that he put on that.
Right. I mean, really, smoking is probably your bigger risk for oral cancer. But
No, I don't smoke. I just,
I just please the ladies. gosh.
Why did they call it performing anyway?
Yeah. Gosh. Ask Michael Douglas.
Yeah.
So HPV. So some of the other things that we can transmit via oral sex, gonorrhea and chlamydia are another one. So it's really important that if you're engaging in oral sex, that you do get screened for gonorrhea and chlamydia orally. It's also important that if you've got throat pain that isn't going away and the strep throat tests are all negative and you do engage in oral sex, that you get tested for gonorrhea and chlamydia.
Do they just do like a throat swab like they would for strep throat?
Yes. Yeah. Except it's a different process. But so same throat swab, except that we send it to the lab and they do the same tests that your vaginal swab would be tested for gonorrhea or chlamydia.
So if you go to the doctor and you have a sore throat, like, does it look like strep throat? Like, would they have to know to put in additional tests? Because I would think that, like, your baseline sore throat test would be a strep test. Like,
yeah, your doc's not going to be like, oh, I'll test you for strep and chlamydia. No, that's not a thing. So yeah, a lot of our STD clinics, like Planned Parenthood, they test routinely for these things as a screening tool. So when you go in and you give your sexual history and you say, I engage in oral sex and penetrative sex, vaginal sex, then they will say, oh, we'll do a vaginal swab and we'll do a throat swab. If you aren't at an STD clinic and you're just going to your friendly family doc, you can certainly request that be tested. The other thing is, if, like I said, you've got a sore throat, it's not going away because they thought it was strep throat and, they treated you appropriately, you still have it, then you really need to pursue testing for STDs.
Now, are those two also, can they sort of be dormant and you be asymptomatic?
Absolutely. It's really important to note with most STDs that the rule is not the symptoms. So most people do not have symptoms. Like we talked about before, someone can look completely clean and have lots of infection. So that's why it's really important to use dental dams on a female when you're performing oral sex on a female, or you use, condoms when you're performing oral sex on a male. Now, most people do not want to perform oral sex on a balloon, essentially.
Yeah.
They taste terrible. But we have flavored options. So there are flavored condoms and they work really lovely for decreasing the risk of STD transmission when performing oral sex on a penis.
If you didn't have a dental dam readily available, could you grab some saran wrap?
Don't do it. People do this all the time.
Do they? Because I'm just trying to think about
right.
Can you MacGyver one?
No. The other thing is people are like, oh, what if I cut a balloon? Generally, really just get a dental dam. You can get those from your friendly STD clinic. You can buy them online.
Yeah, they don't have those at the CVS, do they? I don't think I've ever seen. Maybe. I mean, I haven't really perused that section in a while.
Yeah, I have to be honest. I haven't looked in a long time.
What about Walmart?
FYI, Amazon. I just went to Amazon. Oh, there's a ton of dental dams you can get. And we can get powder free. We can, I believe these ones are mint flavored. So there's a lot of options here.
They have them on Walmart, but it looks like it's for dentists.
No. Well, that's the thing is I was about to tell you. So dental dams are used all the time in dental work.
Not attractive.
I know. That's not how you use it. That picture is literally like someone sitting in a dental chair getting dental work. So yeah, that's probably why they were invented. I don't know the history of the dental dam, but I do know that I did have some dental work and they popped one out and I was like, huh, I've seen those at work. And I don't work in a dentist's office.
So if you were trying to get some of these, what would be your best resources? So online,
it looks like Amazon has some good options. Also, I'm partial to Planned Parenthood. I really like that they really are meeting most people's sexual needs. So they do have some that you can get there. And obviously you can get condoms, lube, all of that stuff there as well.
They're square.
Yes, they are.
Why are they oval?
Because, again, I think they were made for dentists.
But your mouth isn't square either.
No, so, the logistics of it is that you're holding it over female external genitalia. And you're doing you're performing oral sex over the dental dam, which is laying over the genitals. And so you really just...
Do you stretch it?
I mean, I've never used one, but...
But you've seen one.
Yes.
More than I can claim. Like, it's not like a condom where you have to, stretch it.
They are stretchable. They're made with latex. I think you can get some non-latex options as well. So they are stretchable, and you can basically make sure that it's covering everywhere that you're working.
Performing everywhere that you're performing.
Yes. So you can make sure that that it's covering everything you need, and you can do that by stretching or repositioning.
Are you supposed to cover all of the external genitalia too?
Yes. So you're using it to cover the clitoris, the labia, vaginal opening if you're working there. Basically everywhere. The big takeaway though is that you want to be covering things so you have a barrier of protection from whatever place on the genitals that you are giving pleasure, and you want to make sure that there's not skin to skin contact between genitals and your mouth. One thing that I think I need to talk about is that you don't reuse these. So you're not going to wash it and dry it. Dental dams are made to be thrown away just like condoms are.
Was that a question that people have?
Yes. Yes. So, you could get, here's one on Amazon, 12 units for $13. So, that's about the price of a condom as well. So, or some condoms are a lot cheaper, but, it's a one-time use. Just plan on throwing away that $1 at the end of your night.
Oh, man.
Your night was worth more than $1, honey. So I have one final question for you.
Okay.
Miss Eek, she's been dating her partner for more than a year, and then she just tested positive for a sexually transmitted infection. She's freaking out because she says, well, they must have been cheating. True or false?
I know intellectually that you're going to tell me that's false, but in my heart, I would react as if it were true.
Girlfriend, I would too. But it is false. We do not know for sure. And so, there's a couple of reasons why we don't know for sure. So the big question would be, when was the last time Miss Eek was tested, right? She's been with her partner for a year, but if she hasn't been tested in 3 years, that means she had 2 years prior to her partner to get a little present that she brought into this relationship.
And has she been sharing a Jamu stick with anyone?
Yes, I mean, that should be on our question list as well. The other question is, did her partner get tested, and when was he tested? Basically you can enter into a relationship with your partner and you enter with that STD. You bring it along with you. So that's why it's really important that you're getting tested before sexual contact, so that, you don't have to play this game a year in when you finally get tested and find out you or your partner is positive for a sexually transmitted infection.
And what is a screening test? Is it blood or...
That's a really good question, Dr. V. So I feel like a lot of times I hear people say, test me for everything. As a doctor, people have come in and been like, test me for everything. I'm here for my pap smear. Or maybe your partner has said, oh, I got tested for everything. P.S. There is no everything test. So it's really important to say what you'd like to be tested for.
What if you don't know?
Right. And that's why it's really important to have a discussion with your doctor about risk. So let's say you don't know. I mean, maybe you don't even know what sexually transmitted infections are out there. It's not your job to know. It's your job to talk with someone who knows more than you, like a nurse practitioner, PA, or a physician that can say, oh, your risk, you are having unprotected sex. We need to test for gonorrhea, chlamydia, syphilis, hepatitis, HIV, all those things. And it's important to know, too, that each infection has a different way of testing.
Okay, so if somebody were to come in and say they're like, I don't know what the average age of a college kid, like 20, right? And they've been with a handful of people and they're about to embark on this new relationship, and the partner's like, I want a clean bill of health. And they're not asymptomatic. They don't have any symptoms and they feel perfectly healthy. What would be like a routine test?
So I think routine varies, to be honest. Yeah. So we have CDC guidelines that tell us what general testing is appropriate for people below the age of 26, and that's yearly screening. We talk about people above the age of 26 and what their yearly screening should look like. And then we also have screening based on risk. So general screening would be gonorrhea and chlamydia. That's just, it's super prevalent, and that requires either a urine test or a genital swab. We generally believe that the vaginal swab is going to be more accurate than a urine swab for women. For men, either one will do. And then, HIV. Everyone should be screened for HIV at some point while they're sexually active. And if they have risk, they should be screened more frequently. Now, HIV testing can be done super easy these days. You can get an oral swab. Like, they just swab like they're doing a DNA test in your mouth. So easy. And they can also do it with a finger prick of blood.
Not from Theranos, though.
Not Theranos.
Do you not trust the Theranos HIV testing? Okay, so I have a question for you, because I think, like, historically, people have always, even though we know intellectually it's not true, you're like, ew, STDs is like dirty, hoary, slutty. Like, there's sort of that idea, and so people feel embarrassed to ask for it. So true or false, if somebody were to come into you and say they want that testing, that you would judge them and be like, gross?
I would judge them by thinking, dude, you're awesome for getting tested. No, but seriously, like, there's no judgment. No docs ever judge, because really this is about decreasing disease transmission. This is not about risk as far as like, ooh, you're doing dirty things, I don't want to test you. Like, or ooh, you need to be tested. No, this is about just like, it is what it is. Let's get tested so that we can treat what can be treated, and we can all work from a place of knowledge. Don't forget to subscribe to our WooCast on iTunes, Google Play, or directly on our website at whatthewoopodcast.com. You can email us at contact@whatthewoopodcast.com, or go to our website and fill out the contact form there. We'd love to hear from you.
What the Woo is an educational podcast and is not a substitute for professional care and advice. Please seek appropriate medical care for any healthcare concerns. Opinions expressed are solely those of the doctors and not those of any sponsors or employers. Thanks for listening. See you next time on What the Woo.